Hey, you guys. So, in this video, I want to cover what it looks like to work with our medical practice. And so, we're going to jump right in talking about the framework that we use in this practice and how it might be different than what you've previously experienced. So, as you know, this is a functional medicine practice. So, what does that mean? It means that we address the root causes of illness. And so, in this image, I'm showing that conventional medicine is kind of what's happening at the top, where we make diagnosis of diseases or symptoms, and then we treat it with maybe very specifically with a drug or a medication or a surgery. So, diabetes or depression, anxiety, lupus. Knowing the names of these diseases are important, but they don't tell you why you develop them. That's where functional medicine comes in. The why is in the roots. What are the things that we know influence people's overall health? And this is based off of the science of epigenetics, or how your environment influences your health. And so we're really focusing in this practice on those root causes, things like inflammation, stress, hormone balance, right? So we are addressing more of the root causes, not specific diseases. Now, I am a conventionally trained doctor, so it's important to me to know what conditions you've been diagnosed with, what medications you were on. But really, the approach here is to really focus on those root causes. And so that's more of a lifestyle based approach. So I developed a framework that I use within my practice. It's called the People's Life Prescriptions, and you'll hear me talk about this often. It's the way that we are able to action item the factors that influence your health, right? So if we're looking at the root causes, I can say all of the root causes. Oh, you need to improve your nutrition, you need to improve your sleep, you need to detoxify. But really, how do you incorporate that into your life? How do you make a lifestyle around healthy living? And so the People's Life Prescriptions is where I prescribe health, and I prescribe them under each one of these prescriptions. So personal life has to do with your intention, your mindset. Food life has to do with food and nutrition, using food as medicine. Sleep life has to do with developing a routine around sleep and making sure your sleep is optimal so that your body can fight illness or prevent disease. Resilient life has to do with the impact of stress on your nervous system. So this isn't really a psychological therapy. It's more thinking about how do we balance your nervous system from a scientific perspective, honestly, but through lifestyle. Detox has to do with limiting our exposure to toxins in the environment, as well as improving our body's ability to detoxify. Fit life has to do with movement, and connected life has to do with connection in our environment, and the people in that environment and how that influences our health. So these are the basics, right? A lot of people who come to a functional medicine practice have to get these core basics under order so that we can move on to more advanced things if necessary. So, what are some of those advanced protocols in this practice? So, the advanced protocols would include things around longevity, which is long life. Hormone life has to do with bioidentical hormone replacement or hormone balancing, perimenopause, menopause, premenopause, and conditions like endometriosis, PCOS, fertility. Immune life has to do with autoimmune conditions and really ironing out the factors that influence autoimmunity. Gut life has to do with the GI system or your gut health. And metabolic life has to do with metabolic diseases like diabetes, heart disease, obesity. So, how do we do this in this practice? So, the journey is either or in the very beginning, with steps 1 through 3 are our foundational assessments. So essentially, what I do is I collect information about your history. We get comprehensive labs or basic labs. And given that information, we're able to develop a protocol. And that protocol will include things around uh, nutrition, fitness, all of the People's Life prescriptions. And then I pair you with the health coach so that you can have support as you go through whatever protocol we develop. And I'll explain more on this later. But in addition to just having a comprehensive assessment and labs, you get one on one appointments with me. So, this is what makes this program different than maybe a health coaching program that you may have already done. So you have one-on-one appointments with me where I will go over those labs with you and give you my assessment. There's health coaching always include it because health coaching is a foundation to being able to make the changes that you're looking to make. There are lifestyle protocols that I'll put together based off of the People's Life prescriptions. There are online learning opportunities that I've curated specifically for you, for your specific conditions, questions, and needs. Bioidentical hormone replacement is something that it's really big in this practice because I do believe that hormone balancing is important for women's health. And then supplemental and botanical recommendations so that you're not guessing on what you need to take, but you're getting, direct recommendations based off of your personalized assessment. And then direct messaging access. So that allows you to communicate with me and the health coach so that you don't have to wait from appointment to appointment to get your questions answered. So, what does that look like in the grand scheme of things? So, once you join the practice, either with an initial appointment or within the membership, you get access to the online portal. And the online portal is where we do a lot of our work. So, this is a bit of a tech driven practice because we're in the modern era, and using technology is going to be the thing that allows us to do our virtual visits and for me to be able to track and see what's going on with you. So, what can you do within this portal? So this is where you'll get your comprehensive intake, your forms. There's a place for you to record your lifestyle journals. This isn't just for you, but it's so that we, as your coaches, can see what you're eating, what's impacting your health, and we can really track things more closely. This is where you would sign in for any one-on-one visits or group visits that you may be a part of, where you'll get access to your protocols as well as any programs that you are enrolled in, and then also where you can do direct messaging and any billing, or you can schedule your appointments here. So everything you need is within this portal. And we're here to help. So there are tons of videos as well as one-on-one engagement with the health coach if you're having issues. So, what does a protocol actually look like? So, a protocol is something that after we've met and I've taken a good look at your health history and your labs, I'm able to identify where are the areas that we should focus on. And usually, a protocol will last you anywhere from um, 2 to 3 months. Usually, there's some form of a dietary recommendation. If there's a specific area within the People's Life prescriptions that we really want to focus in on, so maybe sleep is your issue or stress is your issue, then those might be areas that I might highlight. I typically won't include every prescription under every protocol because the idea of a protocol is to allow you to focus in on a specific area of your life to improve your health over a short period of time. And then we build on that. So your first protocol usually will last about 3 months. And then at the next visit, we will reassess and maybe continue that protocol or we may add on. So we basically build over time. And that's sort of that mountain that we saw in the very beginning. With every appointment and every encounter, we're building on your overall health. So there are also online programs. You may have already done a program. Oftentimes, I'll create specific videos around specific areas so that when I do put something in a protocol for you, if you need more knowledge on that topic or you need more support, there are just multiple ways for you to get those answers. I mean, there are forms, there are videos, there is written content. There's so many different ways for you to get the information that you need. And oftentimes, if you are doing a program, this is really great to pair with your health coach because she can help answer those questions for you to be able to personalize any recommendations throughout those programs for you. So, using the online programs is optional, but it is a benefit of the program. Or of the overall involvement in the practice. So, virtual health coaching is the foundation of this program. I know a lot of people who come to the doctor, they expect the doctor to do to be the beginning and the end. They just really want their labs, they want to know what to do. But one of the things that makes this practice very unique is that we really focus on behavior change. We focus on lifestyle and those factors that you may have been struggling with your whole life. One of the things that I've realized is most people haven't been taught some of the foundational things that will actually get to the root cause of their symptoms. And it's hard to figure those things out on your own. And I don't want you to feel lost in this process. So the health coach is here to take the protocol that I've developed or that we've developed together and to help you walk through it, for you to help you figure out where do you need to focus, where are the pitfalls, helping to give you very specific and individualized guidance on how to make that protocol personalized to you. So, health coaching is super important, but it's also a great way for us to track what's going on with you. So, in our health coaching, in our portal, you're able to track things like your lifestyle, your bowel movements, the foods that you're eating, your weight, your measurements, your biometrics, all of those things we can track from a distance so that when we see you during our sessions, we can really go over what's been working and what's not been working and what things need to be tweaked. So, in the next phase, I'm going to talk a little bit about some of the advanced testing that is involved in the memberships. Now, all of the basic testing are lab tests. And these are things that you may have gotten from your primary care doctor or not. Usually, not everything that I order in my basic panel is in a panel that you might get from your primary care doctor. But you're more than welcome to add those or upload those previous labs, and we can decide what needs to be done going forward. Beyond basic labs, there are some advanced lab testing that can be valuable when appropriate. So I'll go over the ones I do in my practice. So there are nutritional testing. This is oftentimes a test that I might do if I'm really concerned about nutrient deficiencies. If you're not eating well, or if you think you're eating well, but you're still having symptoms, maybe there's a nutritional deficiency that we need to look at. So we're going to be looking at antioxidants, B vitamins, minerals, and it helps to tailor what we need to focus in on. It also helps to tailor your supplement recommendations if you need supplements. But we can also identify foods that you may need to incorporate to make sure you're getting the appropriate nutrients. So, gut health is also a vital part of this practice. If your gut is problematic, which I would say 80 to 90% of the patients who come into the practice typically have some sort of gut imbalance. We don't always need to do comprehensive testing for this, but sometimes the testing can guide us and it can help us determine if we need to be more specific in our treatment. It can also help us track. We do an intervention and then we can retest to see if we've actually made the improvement that we're looking for. So, gut health looks at your microbiome, it looks at leaky gut, it looks at pathogens or infections that may be underneath, it looks at inflammation. So the gut health panel is really great. And obviously, I can go into more detail, but not in this video on each of these tests. So I don't do a ton of food sensitivity testing. I don't find it to be that valuable when you get one of those panels that has like 182 food sensitivities. But there are some food sensitivity, there's a specific food sensitivity test that I do like when we are concerned about a specific food. So there is some food sensitivity testing that I do. I just like to highlight that. And if I feel like that's something that you may benefit, then I may recommend that for you. Environmental toxins is something that if we know that you have exposures, if we are concerned about toxins or mold or anything like that being a major contributor to your symptoms, then environmental toxin testing is something that we offer. And then there's hormonal testing. And in your basic labs, we will get what we call serum or blood levels. But I often find that getting a more advanced test can be really helpful, particularly for hormonal imbalances. And when I talk about hormones, I'm talking about sex hormones, but I'm also talking about stress hormones. And so the major test that I do looks at sex hormones and stress hormones. So this is just an example of that. But one of the things that's really important if you're going to be doing hormone replacement therapy is for us to look at your urinary hormones. So this is the same test that I just showed you with the adrenals and all of that. But this is why this test is more valuable to me than just a blood work, because looking at your urinary metabolites helps me understand how you're breaking down hormones and how that may be influencing your overall health, as well as preventing any chronic illnesses. So this is what a uh, journey in the people's life functional medicine practice looks like. If you have additional questions, please let us know. But I hope this gives you an insight on how this practice may function differently and what benefits you might be able to glean that you're not able to get from your conventional doctors. I will see you guys in the next video or in the practice. Talk to you soon.